Hello, I am Dr. Bishas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Dan Sakov, 50 years.
Nice to meet you, Mr. How can I address
Yes,
you?
you can call me Dan.
Okay, Mr. Dan. I have got a letter from your GP saying that you have high blood pressure for last 3 months. Is it right?
Yes, doctor.
So I'm going to take detailed history and all the information during our discussion will be remain confidential. Is that okay for you?
Yes, doctor.
Okay, so can you please tell me in your own word what has happened to you?
Well, doctor, actually, for the last 3 months, 3 months back, actually, first of all, I had some heaviness in my chest. Okay, I thought that I felt tired. Not heaviness. I felt tired after walking for a bit, and then I went to my GP. At that time, the GP measured my blood pressure and told me that I had some high blood pressure. And within 2 weeks, he actually recorded my blood pressure for many times, and almost most of the time it was found to be more. And then he actually prescribed me some medication, which is I think thiazide. But till now, my blood pressure is more, and it's I think the last recording was also more than normal. So now I am very worried, doctor, that what's happening and what's going on with me.
I'm sorry to hear that, and let me find out that what has happened to you. And, so can you please tell me that before these 3 months, have you ever checked your blood pressure?
No, doctor, I haven't felt the importance of it.
Okay. And in the meantime, did you develop any other symptoms or any other problems?
What symptoms, doctor?
Any headache?
I have had headaches sometimes, doctor.
Can you tell me more about that?
Doctor, I have been diagnosed a diagnosed case of migraine, doctor. That's around for 4 to 5 years. So, no, sorry, for around 10 years. So that's my headache is.
Okay. And is it same like before, or has it changed in
No,
recently?
doctor, that's almost all the same.
Do you feel any headache in the morning?
No, doctor.
Have you noticed that your headache get worse when you cough or sneeze?
No, doctor.
And have you noticed any changes in your mood?
No, doctor.
How do you get sleep at night? Is it fresh or unfresh?
It's quite okay, doctor.
Have you noticed any changes in your vision?
No,
Any changes in your color of eyes?
no,
Any reaction in your body?
no, doctor.
How about your appetite?
I think it's quite okay, doctor.
Have you noticed any changes in your weight?
No, doctor.
Do you have any hot or cold preferences?
Doctor, you told about weight change, but I haven't measured my weight change. But I think my dresses are getting a bit uh, more spacious, doctor. Something. Sometimes I think.
And, what do you mean by more specials? Can you
I think they are more drooling my dresses. Okay. Previously that were feet, but now I think the dresses get hanged up.
that means you are suspecting you are losing weight?
Yes, I haven't measured it, but I suspect.
Okay. And what about your hot or cold preferences? Do you have any weather preferences?
Doctor, yes, I have. I think that I feel much better being in cold environment.
For how long you are having this?
Doctor, I think for the last 6 months.
Okay. And can you give me any example of preferring this hot and cold, or any preference to cold?
How can I give example, doctor? I think that I give a bit restless while being in hot weather nowadays.
Okay. Did this happen to anyone that others family members are wearing warm clothes, and at that time you didn't wear any warm clothes where you would normally use warm clothes like this?
Yes, doctor, I think so.
Have you noticed any lumps or bumps anywhere in your body?
No, doctor.
Any lumps in the neck?
No, no. I haven't noticed it, doctor, but I noticed that there is some racing and pacing of my heart
Okay. And for how long?
for the last 6 months, I think, doctor.
Okay. And can you tap me out? Can you show me by tapping out the how?
It's regularly regular.
Okay. And when it started, for how long it persist?
I think for 10 minutes.
And have you ever felt dizziness?
No,
Have you ever lost consciousness?
no, doctor.
Do you have any chest pain?
No,
Any shortness of breath?
no,
Any cough?
no,
Do you have any cough?
no cough, doctor.
And how about your bowel habit?
All right, doctor.
Have you noticed that you need to pass more bowel?
Uh, yes, doctor. I think recently, sometimes I think that I have to pass more bowel.
And how many times a day?
I think sometimes 3 to 4 times a day.
Okay. And what about your water work?
I think it's quite okay.
And coming to the bowel. That have you ever noticed any blood in your stool?
No,
Do you have any weakness at any side of your body?
no, doctor.
Any joint pain?
No,
Okay. I am that. May I know that have you ever had any past medical condition or any disease in the past?
no, doctor.
Any jaundice in the past?
No,
Are you taking any medication?
no, doctor. No medication, doctor.
Okay. And do you take any over-the-counter medication or any herbal products?
No, doctor.
Do you have any allergy to any medication?
No, doctor. I don't think so.
Okay. And any of your family member have high blood pressure?
Doctor, I think my uncle had some issues with high blood pressure.
Any history of cancer in your family?
No, doctor.
And may I ask you a few personal questions?
Yes,
And so may I know that do you smoke cigarette?
yes, doctor.
How many sticks per day for how long?
15 sticks for the last 15 years.
Yeah. I would like to recommend you stopping smoking because it is related to a condition and also it can it is injurious to health. So if you need help to stop smoking, I can refer you to the smoking cessation clinic. Is it okay?
Okay.
May I know that do you drink alcohol?
No, doctor.
That is fine. May I know that what do you do for living?
Doctor, uh, I am a school teacher, doctor.
And is your condition affecting your job?
Doctor, sometimes I think so.
And in that case, I can contact the occupational healthcare department. They can make an arrangement at your workplace. Will it be all right for you?
Yes, doctor.
May I know that whom do you live with?
Doctor, I live with my wife.
Okay. And may I know that do you drive?
No, doctor, I
Okay.
don't drive.
And is it okay if I ask you a few other questions?
Yes, doctor.
So you have this problem with your high blood pressure, and you have also preference to cold weather, and you have a racing and pacing of your hearts, and also you have some changes in your bowel work. Is it right?
Yes, doctor.
For this, I am suspecting that you might have a condition that is
Okay.
called hyperthyroidism. Have you ever heard of it?
No, doctor. Yes, doctor. No, I've just heard that it's a gland, but I'm not. Thyroid is a gland, but I don't know more about it.
Actually, it is a gland that is present on the neck, and when it overproduces its products, then this type of symptoms can appear. And for this, we need to run some test. Okay,
Okay, doctor.
and after that, we will involve the multidisciplinary team. That is, we will involve the hormone specialist, and we will involve the heart specialist. Okay, and they will
Okay,
be able
doctor.
to give you the best management plan.
Okay, doctor.
And do you have any concern?
Well, doctor, will I be all right again, doctor? What do you think?
Okay, actually, this condition that we are suspecting, it's called hyperthyroidism, and actually, this can be totally controlled with the medication. And I hope that you will be fine with that.
Okay, doctor, that's all right.
So, do you have any other question?
No, doctor, it's all right. Okay.
Thank you.
Okay, doctor. How much time left?
1.5 minutes.
Okay. Okay, okay. Can you please start discussing now?
Okay.
Yeah.
Okay, first, I will like to examine the patient, and for examination, I will like to see his blood pressure, so his pulse, his blood pressure, and after
Mm,
that, I will look for the signs of tremor in the hands, any fine tremor is present or not, and at that time, I also will go for exam, seeing for the thyroid acrophacy is present or not,
mm,
and also peripheral flushing and sweating, excessive palmar sweating. And
mm,
after that, I will come to the eyes, and in the eyes, I will look for any signs of uh, that is called lid lag, lid retraction, and protrusion of the eyeball.
yes.
And after that, I will look for the signs of anemia and jaundice. And after that,
Mm,
I will look for the uh, signs. I look for the uh, eye movement, and then field of vision.
okay.
In the field of vision, if it is caused by pituitary adenoma, then there might be bitemporal hemianopia. And in the field of vision, if it affects the eyes, then there can be a complex ophthalmoplegia. And after that, I will go for the mouth for to see his tongue and oral cavity, and after that I will see the neck gland if there is any swelling or not, and after that I will examine for thyroid gland and also tenderness, and also any presence of any lymph node in the thyroid gland. And after that I will listen, I will auscultate the heart for any
Okay.
additional murmur is present or not.
Okay.
Then I will go for the tummy for any palpable organomegaly.
Okay, doctor. Mm,
And after doing this, I will ask the patient to raise his hand above the head to see proximal myopathy.
okay, doctor.
Okay. And then I will like to complete my examination by measuring his weight and height and urine for diagnostic test. And also I will see, I will do the fundoscopy.
Okay. Okay, so I think that you went quite well. You covered almost all the things, but I think you could have asked some more things. Did you rule out acromegaly by asking some questions or
Mm.
pheochromocytoma? I think you could have just asked these questions as well. Although it was quite a straightforward question of
I could
hyperthyroidism.
have ask about acromegaly, any changes in the shape of the hands.
Yes,
Yes,
because it's actually in the age in this age group.
yes,
I
and
think
any senses in the appearance of face. And also, I should have ruled out Cushing syndrome by asking for any uh,
any joint pain, any something like that. Okay.
joint pain, any rash, any stria on his tummy.
Yeah. This could have been asked. Although hyperthyroidism is present, but I think you could have asked all these also, and some renal involvement, if any kidney disease, you could have asked this specifically. Any previous kidney disease in the family or something like that, and his age. I think. Did you specifically ask about any recreational medication?
No, I totally forgot that.
Although he's 50, but yet he can take
Yes,
some recreational medication.
it is a common case for high blood pressure. Also, I really forgot.
Recreational medication. Although his occupation does not support, but he might take some performance enhancing drugs as well, I think. And But it's not very much relevant in this case, since he's a school teacher. But I think some cases actually you miss pheochromocytoma in flushing, or although you asked about chest tightness, I think, but that could have been another case also, flushing or something like that.
Yes,
Intermittent flushing, intermittent headache. I told about headache. So there you could have asked about intermittent flushing, intermittent headache, and intermittent palpitation. And since I actually ruled out by totaling that irregular, so it was actually omitted. But acromegaly could have been asked, and Cushing's could have been asked. Cons could have been asked by asking any muscle cramps present or not. Okay. Uh, I think muscle cramping is important in Crohn's. Okay.
yeah,
And other cases, I think you have ruled out most of the cases here, most of the things, and that will be all right. I think. Do you want to add anything?
no.
Okay. 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 That's all right.